Hello everyone. If you or someone have any of the chronic medical problems, you are at the right place. In this video, I will be discussing 15 most common questions which are being asked or you must know regarding how to prevent and treat chronic medical problem. It doesn't matter whether you are suffering from diabetes, hypertension, high cholesterol, COPD, or you already have complications from these chronic medical problems. These principles will help you to manage every disease. Let's start. Do you know in the United States, 60% of us have one chronic medical problem at least, and 40% have two or more. This is a surprising fact, and these chronic medical problems start at a younger age as unhealthy lifestyle, leading to chronic medical problems and eventually culminating into chronic medical complications like heart attack, stroke, death, Alzheimer's disease, leading to cutting into your lifespan and decreasing quality of life. When we talk about longevity of life, it depends on two things. Longevity meaning how long we live, and quality. Both quality and longevity must be there so that we enjoy long, healthy life. Let's understand how to prevent chronic diseases through diet. What is diet? No matter what goes into your mouth, diet has 6 components in different proportions. Your food is made up of 3 macronutrients, which is fats, proteins, and carbohydrates. Other 3 are water, minerals, and vitamins. And seventh, which is very important, is fiber. So any kind of food you eat is a combination of 7 things, and they exist in each food in different proportions. If you eat meat, that's predominantly protein. If you eat butter, that's predominantly fat. If you eat table sugar, that's predominantly carbohydrate. Your vitamins, both water soluble and fat soluble, fiber and water, and minerals like magnesium, zinc, iron, all of them your body needs. Your body has a store of all these vitamins and minerals. You use it, you excrete it, and they all need to be replaced on daily basis. So when it comes to diet or in nutrition, what is good nutrition? Balance. Balance means that whatever we eat should provide necessary fats, proteins, carbohydrates, water, fiber, vitamins, minerals. What is processed food and what is unprocessed food and what is ultra processed food? Food which we consume in original form, that's unprocessed. Say for example, you have an orange, you eat the whole orange, that's an unprocessed food. Berries, peaches, they are unprocessed food. If you squeeze that lemon orange and take a juice out of it, you have eliminated fiber and a lot of other good things out of it. Now you have processed it. Same way with wheat. If you eat wheat as a whole, as unprocessed, when you cut it and make it bulgur, that is processed. If you refine it and remove fiber out of it, that's ultra processed. And then if on top of that you add simple sugars, salt, and other things, you make it ultra processed. There's a lot of debate what kind of diet is best to prevent chronic diseases. Your body needs a balanced food. Whether you talk about United States nutritional pyramid, that's predominantly rely on carbohydrates. Then you talk about keto, that relies on both proteins and fat. Atkins, primarily same way. Your body needs everything. If you're consuming one macro, over other, you will have complications. So in order to prevent chronic diseases, your body needs everything, which is quality carbohydrate, fats, proteins, fiber, water, minerals, and vitamins. If you increase one macronutrient over others, you will start missing out on something. And nature is very cunning. Nature has put in some things in animals, something in egg, something in that. So nature intended us to eat everything, but eat in moderation and probably eat in as natural form we can. We have come up with a lot of different kind of diets these days. If in a medical literature everybody comes and talks that the Mediterranean diet is the best, there is a fundamental problem how we study these diets. Most of the time these are epidemiological studies where meaning you are eating in a particular way and you are asked a question. I want to know whether you knew what you ate 3 days ago, and you have to maintain a diary of that. And if you are given certain kind of food in a controlled environment, that is does not represent the reality of life. And in some studies which they have tried to do with the rigorous double-blinded placebo control, there are a lot of other biases gets built into that. So any kind of a nutritional study you ever see, be skeptical, because there is not a good method to reproduce study in real time. We want to know when we come home after work how we eat. What are the things we could change there? If we do not improve there, we will not get better. We will continue to suffer. We need balanced diet. We must learn how to calculate how many calories one should consume. We must understand how our metabolic rate works. To simplify the things, we have created the videos and I will put it in a playlist. Watch those and you will be able to understand how diet works, how you could control your risk factors, and how could you prevent diet. Now the question comes in is, if you eat more than what you need, you will become obese. If you're eating only one particular way and you don't have incorporated everything, you will be deficient in vitamins, minerals. If your food is devoid of fiber, you will have big problem in your stomach. Your gut microbiome will be altered and you will have a lot of metabolic disorders and also a lot of immune problem. That is a topic in itself. But yes, with diet, you could prevent chronic diseases. You need to come in the middle and you need to start consuming balanced diet. Next question, chronic disease management strategies for older adults. Believe me, I see this magic every day. Even at the age of 85, I have seen patients understand that their lifestyle and risk factor has led to chronic medical problems and chronic complications. And they will not give up. They still have a lust for life. They will change their lifestyle, their diet. They will start moving. It will be a lot more harder in older adult, but the game is not over. No matter how old you are, that is the beginning of first day of rest of your life. And this is not my quote. Actually, one of my patients told me, "Doc, happy birthday." And I kept on first initially ignoring it. And he said, "Today is the first day of rest of your life." And kind of that stuck with me for many years. And I've seen life differently since this thing. If you start exercising, eat balanced diet, start moving, control your emotions, sleep, take all your medication as prescribed, do not trust healthcare system, question them. They will actually love you for that because we want participation. We don't want to be your parents and trying to deliver the care. We want to ensure you are a partner in this healthcare delivery model. Yes, even at a very late age, you could improve and prevent chronic diseases. Best exercise routine for people with chronic disease. First, any kind of decision to exercise must be individualized, meaning, based on your medical condition, talk to your physician and they will guide you. But general rule of thumb is 30 minutes 5 days a week minimum, preferably 7 days a week, which and your exercise must include aerobic, strength training, balance and stability. I suffer with chronic knee pain from old sports injuries. I never had a clue how unbalanced I am till I read Dr. Peter Attia's book, Outlive. And I was always an athlete. I was very aggressive with my body and try to work it out and do everything. But I had no concept of basic stability and balance. He opened my eyes through his book, and I have started practicing those balance and stability exercises. That has changed. To prevent chronic diseases in older adults, the best exercise is move, do something. 150 minutes per week, both aerobic, resistance, balance, and stability. That will reduce inflammation and multiple risk factors. Your mood will improve, you will be happy, you will sleep better. Impact of obesity on chronic disease and how to prevent it. In my understanding, obesity is a billboard. It's telling us about your lifestyle, your flashing. That clearly tells how you live, how you eat. Obesity represents your faulty daily habits, lack of exercise, eating wrong, or fad diets. There is practically not any disease or medication which will lead to significant weight gain. Some medical condition can contribute with some weight gain, but it's never more than 5 to 6 pounds. Anytime there is a weight, you have a weight gain, it is your lifestyle. And correcting lifestyle is not easy because in this you are against yourself. I know the word through me, and I know I'm very hard with everybody else, but I'm sissy when it comes to me. If obesity is your problem, it is a lifestyle problem. Look into your eating, exercise, sleeping, emotional reactions, and then your daily routine. If you work all the time and you don't meal prep, you will eat wrong. I have learned in last 4 or 5 years, don't rely on willpower. If you want to lose weight and you have obesity, then don't try to test your willpower. It's a very weak faculty of mind. The self-discipline, very weak. We all falls to lowest common denominator every day, all the time. But how we could do that? If there is no junk in the house, you can't eat it. Meal prep, eating should not be taken easy. You must prepare what you want to eat right up front. Make whatever day suits you as a meal prep day. Learn nutrition for yourself. Your primary care physician is the best resource. And don't follow any fad diets, they don't work. If you want to learn how to lose weight, I will link the videos on how to lose weight. We created 3 videos where we went in detail about the reasons, why we gain weight, how our body changes, and what we could do to improve it. Mental health support for chronic illness, any kind of chronic illness needs support. Depression, anxiety, they all represent a lot of cognitive and emotional burden. Unfortunately, mental health is poorly represented, and also we don't have very good mental health workers availability that quickly. But one thing which is improved since COVID, with the improvement of telehealth, now most of the insurances will offer you telepsych, where they have psychologists and psychiatrists on your device. And I truly believe that's a very good way to deliver mental health services. These technologies are improving, and the expertise and ease the way we could use this is improving. Look into cognitive behavior therapy. Look at Call your insurance and ask them they have a telepsych and they will improve. Join Facebook groups and other resources to get mental health support. Long-term effects of smoking on chronic disease and development. You see, the smoking. Smoking is not you're inhaling, your cigarette is burning, tar is going in, and other chemicals, which we all know that part. When these chemicals enter your body, they are chemical molecules. They affect your cholesterol, they affect your thinking, they affect your emotion, they affect your sleep, they affect your muscles. And once you combine with unhealthy other behaviors, they lead to heart attack, stroke, COPD, cancer. Every state has a quit program. In Florida, we have a very good system where you call, they will work with you. The counselor will first give you total rundown of your symptoms, coping strategies, and then they will offer you nicotine replacement therapies. Take advantage of that. It's never too late. It takes on an average 6 attempts for everybody to quit completely. If you were unsuccessful first time, that does not look bad at you. You must work towards it and stop smoking. In addition to hypertension, diabetes, and high cholesterol, smoking is the fourth leading cause of chronic medical problems. Role of genetics in chronic disease risk factors. Let's look at genetics. Genetics is a blueprint. Can we build any building on a blueprint without workers working on it, without raw material? Absolutely, genetics play some role in certain conditions. But even in those conditions, we must write on that blueprint with our bad habits. If we have a healthy lifestyle, that we take care of our body, our emotions, our thoughts, and our social environment, we will not let our genomics or genetics affect us. And now, with a lot of precision medicine, we could understand you better and we could take care of a lot of medical problems, which was science fiction. Even in my life of being a physician for 27 years, like when I was a young physician trying to understand where healthcare could go, it has changed significantly and it is beautiful. It is a well known fact that every 14 days your healthcare information is doubling up. And can you believe, if we develop healthy lifestyle, where we could go? Genetics do have some role, but your lifestyle has to write on this blueprint. Take care of your lifestyle, your genetics will affect you minimally. How social determinants influence chronic disease prevalence. That is a real big problem. America changes in every 10 miles. And even in 10 miles, depending on which neighborhood you are, based on their socioeconomic status, based on their race and ethnicity, based on their cultural lifestyle, America is different. Socioeconomic status, education, and access to care is huge. I have people who have insurance, they can afford everything, but they don't have a transportation. I have got a ton of patients, they don't have money to buy their medications, and they have to make a decision between food versus medicine. That happens every day. Disparities or social determinants are very, very important. Good part is now we are understanding it, how healthcare is a different based on your income, education, and access to healthcare. Once we have awareness, I'm very sure we will build processes around it. But this is a real problem. If you are underprivileged, you're bound to have, unfortunately, poor outcome. Reversible chronic diseases through lifestyle. Oh my God, this is my favorite topic. Every disease could be reversed depending on you. A real story, real patients. I have people in 80s and 85s lost 60, 70 pounds of weight. I will not mention name of my patient. When I started taking care of her through one of the Medicare Advantage program, she has not gotten out of her home. We had a lot of discussions back and forth. Good part was she was tech savvy and she was able to do the telehealth visits. Educated her somewhere down the line. She got convinced that she got to change. Even though she's old, but she could do that. She lost 70 pounds of weight. Now she walks a mile and a half every day. Cut down medication about 60% of them. And she has a new leash to life. Lifestyle is everything. Let's understand how lifestyle play into that. I have developed my own way of understanding you and myself. I repeat this thing probably 20 times a day. Every human being has a body. You have emotions. You have thoughts. Those three. Plus, you have a way you conduct your life. I call it a spiritual domain. You could call it whatever the way you want to handle it. There are four domains: your body, which is physical, emotional, intellectual, spiritual. Those four domains are your personal. Fifth is your social, which encompasses everybody around you. Your social environment, once you come out of you, there are only five things around you: other people, places, things, event, and time. So, whole autobiography of every human being is about your body, your emotions, your thoughts, your spiritual or personal GPS, how you conduct your life, your social environment, which is about other people, other places, whether it's home, work, or anything else, things, events, and time. So, this whole process, when we talk about reversing chronic diseases through lifestyle, sleep, rest, exercise, your mind needs stability, gratitude, your thoughts needs stimulation, critical thinking, and analyzing the things for what they are. You have overarching principle how you want to handle your life. That's your spiritual domain. Then social environment. Who are the other people in your life? Your family, your friends, your city, your town, your state, your country. As much you could expand, that's your social domain of people. Then places, your home, your work, your recreational space. Things, your computer, your camera, your iPad, any kind of toy. Time. We all through flowing through the river of time. And then the last one is any kind of event, your marriage, Christmas, birth of a child, anything that is. So take care of all five domains of your life. And that's how you could reverse your chronic disease through that if you take care of that. How technology is improving with the chronic disease management. I think if healthcare is going to give you something which is really important is telemedicine. You need to take care of all five of them. You must take care of your body. Body needs quality food, wearable devices, and mobile health. Let's explore. I gave you a case study of my patient just with initially meeting her and then on telehealth. I was able to help her to change her life. Wearable devices like your iWatches or Samsung watches, they have collecting a lot of data which you are not even aware. Your wearable watches can provide you VO2 max, your high interval training, your blood pressure, which is coming soon, your pulse ox, your saturation, your sleep, bunch of other your biological real time parameters they could provide, where if you incorporate that with your physician, you will be able to make a beautiful decisions. Wearable healthcare devices. Let's say if you're diabetic and Dexcom or Libre glucometer, which is like a small dart, goes on your skin. It checks your sugar every minute or every 5 minutes, depending on device. You know exactly right that moment if you ate something wrong, how it affected your sugar, or you exercise, how your sugar went 30 points down. You get real time feedback. I think that is going to revolutionize this thing. As a whole, America is not healthy. If America has to become healthy again, continuous feedback, policy changes have to come into place. But wearable devices, teletechnology, mobile health, integrated electronic medical records, and exchange of health electronically, documents and information has to be part of it, and that's going to revolutionize it. I saw one young man who was a son of my colleague. He had some issues. Child had blood work somewhere else. The mother brought it to me. We saw the patient. I was able to get the kid's blood work, which was done same day on the interface, even though he was not my regular patient. 6 months ago, before this technology was shareable, it would have taken me 3 to 4 days and probably 2 hours of my employee time to fax the authorization, get it back, and then information coming on a paper which I cannot analyze properly. Digital health is here. Digital health is improving significantly. Actually, this question has given me idea. We will create a detailed video on digital health and I will elaborate more on this topic. Early detection methods for common diseases. See your primary care physician regularly. Go for annual physical every year. We, as primary care physician, when you come to us, we talk to you first and we are evaluating your risk or your lifestyle, and we could predict what chronic medical problem you're going to develop in future. If you could correct it, lifestyle, you will not have high blood pressure, obesity, arthritis, heart attack, stroke. Next, come to the cancers: breast, colon, prostate, lung. These four case cancers will represent about 90% of the lung cancer all the cancer diagnosis. We have screening tools for that. Five cancers we look for in case of ladies: breast and cervical. If you're a smoker, lung cancer, colon cancer, if you and prostate cancer in the case of males. If we could do routine mammograms, colonoscopies, and appropriate PSA tests and low dose CAT scans and regular pap smears, will protect you from developing cancers. If you take your prescribed immunization, we could prevent all illnesses pretty critically. If you look at it, now we are in the winters. If you take your flu shot, your pneumonia shot, your RSV shot, your COVID shot, you practically make yourself immune to all winter illnesses. Problem is not that technology doesn't exist or things don't exist or you don't know. Problem is in action. You must act on it. Develop a relationship with your primary care physician. They are your quarterback. They are the one who can make you live longer and healthier. Affordable healthcare options for chronic disease treatment. I think this is a topic which is bigger than me, but there are a lot of programs which are available. You should ask some insurance agent about that. Environmental factors contributing to chronic diseases. Air pollution, chemicals, poor water quality, all are leading to a lot of respiratory and other problems. Concept of Parkinson's law of triviality. If you eat right, exercise, manage your emotions, sleep, and take care of social environment, this we will not be talking about. These things do contribute, but they contribute very little. Take care of the bigger things. Pareto's law says you take care of the 20% of the things that will produce 80% of the results. Nobody on this earth can control 100%. Answering your question, air pollution, chemicals, pesticides do have side effects, but they all are not as significant as our lifestyle. How chronic disease impact quality of life over time. Chronic diseases lead to chronic complications. Chronic complications kill quality of life. I talk to patients so many times every day. Everybody wants to have a long, healthy life. Nobody wants to have complications. But the bad part is, nobody wants to change their lifestyle. As Americans, we want a pill or a procedure to correct us. That's not going to help. We must take individual responsibility. We have a beautiful healthcare system. If you own up, healthcare system will work for you and they will improve yourself. Personalized treatment plans for chronic illnesses. That is where we are going. There is an evolution of medicine. We used to have medicine 1.0, as Dr. Peter Attia says in his book Outlive. Medicine 1.0 was that we had some wise people who have observed some good effects from whether it's herbs, exercise, or any potion they made. It was only observational, never tested, never reproduced. And they got us well through centuries. In last 100 years, or primarily 50 years, we are on medicine 2.0, where everything as a physician I do is studied. I could back it up with the scientific data. It's reproducible. But there we try to understand diseases and treat diseases. Now we are at medicine 3.0. Medicine 3.0 is we have understand why we get sick. Now let's prevent it. Let's understand the risk factors and also individualized, because your body is a different than my body. I'm an Asian. My liver works differently. It eliminates the things at a different level. Certain things fast, certain things slow, same as the kidneys. So we all are different. With this, we could understand. Now we have the test data. We could understand you individually and we could generate intervention to help you. Personalized medicine for chronic illnesses is the way to go, is here. Conclusion, I truly believe for us to improve as an individual, let's all take small steps. Let's not get lost in trivialities. Let's do 20% of what we are supposed to do. Let's start with balanced diet, exercise, regular checkups, regular sleeping schedule. As a healthcare provider, we will focus more on prevention. Our problem is when you come to us, you are so sick, you have so many chronic medical problems, the prevention is not even talked about or is on the back burner because we are trying to solve your chronic medical issues. Policymakers, let's change the paradigm. Let's change the way you pay us, how you incentivize us. You have built a system to keep us sick, and you are incentivizing us to take care of sick people. You are not incentivizing us to keep our population healthy. It is a collective responsibility. Individuals, healthcare delivery model, policymaker, if we all work together, I do think we will have healthy America again. Thank you very much. I will see you in next video. I have linked multiple videos in this playlist. If you have been here up to this point, I think you will like that video. Thank you.